Dr. Zucker has submitted his resignation, our Commissioner of Health. I agree with his decision.
Long overdue. That's the reaction from many tonight on State Health Commissioner Dr. Howard Zucker's resignation.
CBS 6 breaks down the months of scandal, stonewalling, and criticism that led to this moment, and what's next for the Hochul administration.
CBS 6 News starts now.
Major developments today with embattled New York State Health Commissioner Dr. Howard Zucker submitting his resignation.
Governor Kathy Hochul making the announcement at the end of a COVID briefing today. We have the resignation letter right here from Dr. Zucker. In it, he says, in part, there comes a time when the baton should be passed in this marathon journey that we call public service in New York State. With a fierce dedication to the public's health, I have carried it through many a crisis in the last 7 years and 5 months and placed the welfare of our residents at the forefront of all things professional and personal.
Dr. Zucker says in his resignation letter that he will help ensure a smooth transition to the next state health commissioner. He won't be leaving the role immediately, though, as Governor Hochul explained this morning.
He has agreed to stay on until the position will be filled. He understands that in this time, I've wanted to take the first 45 days to assemble a new team going forward. That process is ongoing, and he understands and he respects that.
The governor thanked Dr. Zucker for his time serving the state as health commissioner, a role he held for the last 7 years. But absent from Zucker's resignation letter any mention whatsoever of the COVID-19 nursing home death undercount scandal. Commissioner Zucker has helped lead the New York State response to the pandemic, and he has come under plenty of scrutiny. He's been sharply criticized for that March 25th order last year, which required nursing homes to accept patients who were COVID positive.
And it appears abundantly clear to his critics that he was well aware that former Governor Andrew Cuomo wanted nursing home death numbers to be undercounted in an effort to burnish his image. Here now, a look back at the complicated history of Zucker and Cuomo and nursing homes. As the pandemic stretched into weeks and then months, Governor Cuomo said his administration was being upfront with facts and figures.
It's not like there's a back room anywhere here where we go back and we look at numbers and secret data.
We soon learned that was not necessarily the case. Questions mounted about how many nursing home patients had died from COVID-19. The state was telling us how many died inside nursing homes, but would not reveal how many contracted COVID in a nursing home and then were sent to a hospital and died there. At a legislative hearing on August 3rd, the State Department of Health Commissioner Dr. Howard Zucker was grilled on those numbers, and he did not have many satisfactory answers.
Let's try and get the full picture here and now. How many of New York's nursing home residents die in hospitals?
So I know that you want that number, and I wish I could give you the number today, but I need to be sure it's absolutely accurate.
A week later, Dr. Zucker did not take part in a second hearing focusing on upstate nursing homes.
6,600 people is the number that we've been told. I suspect that is way below what the reality is.
At about that same time, we began pressing the Department of Health for accurate numbers. When we did not get them, we started our Zucker counter. It has now been 17 days since that hearing and still no word from the commissioner. 17 days. Meantime, the Empire Center for Public Policy was going the legal route, filing a lawsuit demanding a full accounting of nursing home deaths. Bill Hammond is the center's senior fellow for health policy. Here he is last year. Does it make any sense with the state's experience, its reporting methods, its staff, that they can't come up with an accurate count of how many nursing home patients died of COVID in a hospital?
No, I think those are rationalizations because they don't want to put the information out.
Fast forward to January 28th of this year. The Attorney General, Letitia James, gets involved in a major way. She had promised me during her run for office that she would not be beholden to fellow Democrat Andrew Cuomo.
Andrew Cuomo is not my BFF.
And that proved true as she released a scathing report saying, among other things, the Cuomo administration drastically undercounted nursing home deaths, perhaps by as much as 50%. And then a few days later, on February 3rd, the judge hearing the Empire Center lawsuit ruled in favor of the center, and the state had to come clean. After almost 200 days, the Zucker counter was retired as we learned that there were not about 8,700 nursing home COVID deaths, as the state had claimed, but actually closer to 15,000. Now again, Dr. Zucker faced scrutiny and calls to resign or be fired for much of the last year. In the wake of his resignation today, the state Assembly Minority Leader Will Barclay says this: Dr. Zucker's resignation was obvious and overdue, and that he and other Assembly Republicans called on Governor Hochul to make an immediate change, and arriving at this point should not have taken so long. Barclay's statement goes on to say throughout the COVID pandemic, Dr. Zucker was more interested in protecting Andrew Cuomo's image than protecting public health. As Governor Hochul begins the process of finding a new health commissioner, I hope she looks for an individual without ties to the previous administration or the numerous controversies that defined it, end quote.
One of both Governor Cuomo and Commissioner Zucker's most vocal critics reacting to the resignation news tonight. Assemblyman Ron Kim is a Democrat who started speaking out against Zucker's health policies after his uncle became one of the more than 15,000 New York seniors to die from COVID in a nursing home.
There was no way for this commissioner to continue to stay where he was. It was just a matter of time when he was going to step down. Many of us felt like it should have been on day one, but we'll take this and we'll work with the governor to push her to appoint the right commissioner. But with this particular appointment, I really can't emphasize enough that we have to get the right person, a true public servant that's willing to ask the tough questions and work with us to get a broken system in the right direction.
And New York Senator Kirsten Gillibrand also reacting to the news, telling me what the news means for Hochul's administration, and also responding when I asked her if she is going to throw her support behind Governor Hochul in next year's governor's race.
This is giving Governor Hochul not only the opportunity to build a new team, but allows her to create her own set of policies and have her own imprimatur on the healthcare system in New York State. And it is not an appropriate time for political endorsements, but at some point in the future, I expect that I will get involved in that race. But right now, I stand with our governor, and I support her in every way.
Now, coming up in our 5:30 half hour, another vocal critic of Commissioner Zucker speaking out about today's news. Fox News meteorologist Janice Dean, who became outspoken after losing 2 family members in nursing homes, tells me why she believes this resignation happened today. And along with the COVID death undercount, we've been following issues at nursing homes throughout this pandemic. We've gotten calls and messages to our newsroom for months, families and even healthcare workers voicing their concerns. CBS 6's Leanne DeRosa live for us tonight. And Leanne, what are some of the stories that you've been looking into tonight?
Well, in various conversations with family members or healthcare workers, we've heard stories about how short-staffed some of these facilities are, like one nurse caring for dozens of patients at a time. They feel they're not getting the proper care. But I spoke with 2 groups today who are going to reach out to state leaders to find ways to solve this issue and not further it. People who work with nursing homes or long-term care facilities say the staffing crisis has been going on for years, but it's gotten worse recently.
The pandemic has only exacerbated that crisis.
A recent survey by the American Healthcare Association and National Center for Assisted Living, which represents more than 14,000 facilities across the country, says 86% of nursing homes and 77% of assisted living providers say their workforce situation has gotten worse over the last 3 months. On a statewide level, the New York State Health Facilities Association put out their own survey in the last few weeks.
The results are alarming.
Stephen Hans, the president of the State Health Facilities Association, says 99% of providers have CNA or certified nursing assistant vacancies. 98% have RN vacancies.
Because they're burned out, they have to stay home and care for family. There's a whole host of reasons. And now with the vaccination mandate, there's a subset of workers that do not want to be vaccinated.
As a temporary solution, the Health Facilities Association wrote to the state health department proposing a solution because these facilities can't afford to lose any more workers.
Allow those healthcare workers who are unwilling to be vaccinated to continue to work, but be tested regularly for the COVID-19 virus.
Hans says he hasn't heard back from the health department. Meanwhile, family members and advocates are pushing for safe staffing legislation.
Right now, we're at an emergency point, and we have been for 4 to 5 months.
Marcella Goheen started a campaign called Raise Up Care to raise awareness about the staffing crisis and fight for ways to invest in healthcare workers.
They're exhausted. They're traumatized. They're fleeing the industry. It's not because they don't care. It's because they don't have the tools that they need to care. This is a disaster, and this is unconscionable, and this is unacceptable.
Now she's calling on Governor Hochul to listen to families and the issue at hand and prioritize our vulnerable population. Goheen says that Raise Up Care will have a town hall in October, and she's hoping the governor will attend. We also today reached out to the State Department of Health asking about the New York State Health Facilities Association's letter about the vaccine mandate. They responded saying they are aware of staffing shortages, but their overriding focus is on protecting the patients and residents, which is the reason for the vaccine mandate. Reporting live, Leanne DeRosa, CBS 6 News.
Thank you, Leanne. And CBS 6 will continue to follow the crisis in New York nursing homes and what comes next as Health Commissioner Zucker leaves his post. To get the very latest updates, download our CBS 6 News app. It is free for you in the App Store.
We have some breaking news just coming into our newsroom. One person is dead. At least a dozen more are injured, some seriously, after a shooting at a grocery store east of Memphis, Tennessee. Police also say the shooter has been found dead. It's believed they died from a self-inflicted gunshot wound. All this, again, just coming in. You can stay with CBS 6 for any updates tonight. And tonight we're also learning a man has been charged now for the deadly boating accident on Saratoga Lake on the 4th of July this year. 19-year-old Blake Heflin is charged with criminally negligent homicide in the death of 20-year-old Ian Gerber. Heflin was operating a boat on Saratoga Lake when Gerber jumped off it into the water, was hit by Heflin's boat and another vessel. Heflin is accused of not taking safety precautions when operating the boat, and he's accused of doing so while under the influence of alcohol. There is more ahead. Governor Hochul with a new vaccine incentive plan. Prizes for New York football fans tied to getting the shot with the Vax and Win contest. Also, the FDA gives booster shots emergency approval for some Americans. What's next for plans to get a third shot to more people?
And widespread rain continues just west of the Hudson Valley. It is edging ever so slowly to the east, but that's the trend for rain to overspread the region, looking at how much we'll get and potential flooding issues that could evolve overnight tonight as well. That's coming up after the break.
In addition to announcing Dr. Zucker's resignation today, Governor Hochul was also making news on other fronts. She was pushing vaccines in New York City, and she had some help from some rather high-profile friends. With former members of the New York Giants and Jets by her side and Bills Hall of Famer Bruce Smith joining virtually, the governor announced a new football-based incentive for people to get their COVID vaccine. Get the jab and get yourself in a football drawing.
And prizes include sets of game day tickets, over 200 tickets. Hear that, sports fans? 200 tickets available for fans of our New York teams. FaceTime calls with alumni players. I think that sounds like a lot of fun. Special VIP in-game experiences and signed gear from our favorite players.
And among those on hand today was Giants all-time great and fan favorite Carl Banks, who was not shy about using a football analogy.
You know, as a defensive player, sometimes the best defense is a great offense, and I'm encouraging everyone to go on offense against this COVID-19 virus and get vaccinated. It's the way we get back to normal.
The football campaign is called Vax and Win. The first winners will be announced on September 29th. Also today, Governor Hochul and New York City Mayor Bill de Blasio visited One World Observatory with Prince Harry and Meghan, the Duke and Duchess of Sussex. That's the observation deck on the top floor of One World Trade Center. This is the Duke and Duchess's first joint public outing since the birth of their daughter Lilibet back in June.
Well, it's like summertime out there again today. 79, 80 degrees throughout the capital region. Breaks of sunshine. Going to work this morning into this afternoon, sending those temperatures up. This is it, though. The party is over in terms of this kind of warmth and this kind of humidity, at least for a while. I'm looking for temperatures over the next couple of days to come down to more seasonable levels. No dramatic cooling, upper 60s to around 70, I think, will take us right through the day coming up tomorrow. And that is going to take us through the weekend as well. Let me take you outside right now, and we'll show you what's happening in Amsterdam. We're looking at clouds and rainy conditions, temperatures in the low 70s because the rain has pushed down the Mohawk Valley. It's getting close to the capital region, on its way, and some of that rain, as I've been advertising for the past couple of days, is going to come down pretty hard. It's been doing that already in the western Catskills, and that's where you can see temperatures are a bit cooler in the 60s right now, but still Troy to Saratoga Springs to Schenectady, North Adams, Cambridge, all in the mid to upper 70s. Balmy breezes continuing in advance of a front. Dew points still sitting here in the 60s, but there's the sharp line. That's where the cold front is between Syracuse, Rochester, between Binghamton and Elmira. Dew points drop back into the 50s. So that dry air will steadily make progress east, and we'll see those dew points really dropping back down into the refreshing category by Friday afternoon, and certainly by the weekend. This much more typical for late September than what's going on out there right now. Southerly flow, though, again, pumping up the moisture. The rain band is actually a couple of hours ahead of schedule, so we've had heavier downpours now breaking out western portions of Fulton, Montgomery counties, into Schoharie, Otsego, Delaware counties, and some very heavy rain again just to the west of Oneonta right now. It is still edging ever so slowly to the east, so it is going to be a while before it gets into especially western New England, but that's the trend for the rain to continue to spread east in advance of the slow-moving front. Big storm system here is actually lifting north, and it's not surging to the east, and that again is in response to this big blocking area of high pressure, which continues off to our east right now. So that moist flow coming in right off the Atlantic Ocean, and that produces heavy downpours for us. Some thunder as well. So again, we're looking at a lot of rainfall in a relatively short period of time. Here's the simulation through midnight. That rain band generally oriented in the Hudson Valley, so this is a period where we'll get some of our heaviest rain, and then into western New England probably prior to daybreak. So again, running a little bit earlier than the thinking this time yesterday, and that means things are going to kick out a little bit earlier as well. So I'd say by mid-morning Friday, most of the rain should be clear of Bennington and Berkshire counties, and you can see there will be some pretty sharp clearing. So overall, once the rain kicks out early, Friday's looking like a pretty good day here with a decent amount of sunshine. Again, cooler temperatures and lower humidity. Expecting about an inch and a half widespread, locally 2 to 3 inches of rain overnight tonight, so that elevates the risk for urban and poor drainage flooding across the entire area. Could be some isolated flash flooding as well. Best potential for that down here across the Catskills, Mid-Hudson Valley into Berkshire County with this flash flood watch that'll be in effect through the duration of this frontal passage. By morning, notice temperatures out towards Oneonta, Delhi dropping into the upper 40s with drying and clearing there, but closer to 60 for Bennington. And then during the day, as we see increased amounts of sunshine, numbers into the 60s in the Hudson Valley, probably just pushing 70 for high temperatures, and 71's the average, so that is about where we should be for this time of the year. Into the weekend, Saturday's my pick, 70. Sunday won't be bad though, just a passing shower chance. 68, could be a couple on Monday as well, but overall dry times well into next week with temperatures down a bit, just a little bit below average, and should put our highs mainly in the upper 60s.
Thanks a lot, Steve. And get the very latest weather updates anytime with the CBS 6 Weather Authority app. You can find that in your app store by searching WRGB. The FDA gives booster shots emergency approval for some Americans. What's next for plans to get a third shot to even more people? And a dose of reality report ahead tonight at 6 o'clock, a local mom's push to help others dealing with addiction. Today, the FDA has expanded its emergency use authorization for a booster dose of the Pfizer COVID vaccine. This officially means those over 65 with underlying health issues or people in high-risk jobs are approved to get the booster shot. The CDC is also looking into booster shots. Medical reporter Liz Bona shares the next steps to getting a third shot into millions of Americans.
Hey there, everybody. The FDA has now amended the emergency use authorization for the Pfizer vaccine. It allows for a single booster dose for those who are 65 and older, those in high-risk settings, and those at higher risk of complications from the virus. CDC also held the second day of a two-day meeting today to assist with guidance for this emergency extension. The CDC's Advisory Committee for Immunization Practices now sorting out how to actually best deploy the Pfizer vaccine in these recommended groups.
So once something's FDA approved or authorized, then they tell you how to use it.
Ohio public health specialist Dr. C. Fagan says the suggested use for those 65 and older means he expects a run on the shots in the coming days.
Oh, we totally do. Oh, yeah, we definitely do. And so we've been looking at that, not just the healthcare systems, but the health departments. Our state health department here in Ohio has put out the numbers of when people got vaccinated at a certain age so that we could have some prediction as well as how they would potentially deploy and send out vaccine.
Dr. Fagan says the data here likely to mirror the rest of the country. About 40% of those in the first round of vaccination will soon be ready for Pfizer boosters, which means vaccine clinic hours and pharmacy doses will need to be expanded. As for the high-risk eligible, the CDC focused today on disease states as well as professions. Much of that discussion right now on
healthcare workers maintaining immunity because of the need to be at the bedside,
as well as grocery store workers or those in frontline food service, and those in transportation who can't avoid exposure to others at work. Moderna has asked the FDA to approve booster shots for its vaccine, but the FDA so far has only considered Pfizer's bid. Johnson & Johnson also released partial data this past week that said that it showed a booster dose greatly raised immunity. That company has not yet applied with the FDA to consider a booster vaccine dose. I'm medical reporter Liz Bonus. Now back to you.
Thanks, Liz. Coming up at 5:30, historic parole reform coming to New York State. Tonight, we take a look at the impacts it could have on state finances. And Governor Hochul standing by a vaccine mandate for healthcare workers. Tonight, learning of the latest legal actions against the rule.